Hey, good afternoon, everyone. Now we continue with the visual diagnosis sa Shen Vitality, Part 6. Observation is one kind of examining method which is applied to knowing the condition of disease by means of doctor's visual sense to look over the vitality, color, figure, posture of patient's whole or partial body, and the changes of the figuration, color, texture, and quality of the patient's discharges. Observation is an important diagnostic method in TCM and is taken seriously by doctors in successive dynasties. Just as it is said in the golden mirror of medicine that there is no exception for all the excellent physicians to look over first. It means the observation method is regarded as the first one among all diagnostic methods. So, ito po yung unang ginagawa ng mga TCM physicians. So, ganun din po yung dapat nating gawin. It is realized through the long-term process of medical practice that the pathological changes of internal organs can be understood by means of inspecting the outside of the human body. So, makikita po ang condition ng internal organs through the outside observation of the human body. It is said in the 47th chapter of the Spirit Pivot, observing the outside manifestations in order to understand the inside organs so as to identify the diseases. It is also said in the experience of Dangxi, in order to know the inside, the outside should be observed. So by observing the outside physical features, ma-determine natin yung inside condition of our internal yung organs through TCM. Only observing the outside, it is then possible to understand the inside. Generally speaking, if there are changes internally, they are inevitably manifested externally. So it is manifested through externally or sa labas. Among the various contents of observation method, the face, the tongue have a closer relationship with viscera and meridians because they are more sensitive and accurate to reflect the pathological changes of the internal organs by means of facial complexion, tongue texture, and tongue coating, which have high practical values. It is then formed the two specific observing methods in TCM, namely the complexion inspection and the tongue inspection. Now, the contents of observation are listed respectively as follows. About the origin of vitality, it is said in the 18th chapter of the Spirit Pivot, the combination of two kinds of essence is called vitality. That shows the vitality comes from the congenital essence. It is also said in the 32nd chapter of the Spirit Pivot, the vitality is the essence and chi of foodstuff. That demonstrates the vitality takes the essence and chi of the acquired foodstuff as its supporters. Therefore, only the essence and chi are sufficient. The vitality will be exuberant and the body be healthy. Even if suffering from some diseases, it will not be serious. Otherwise, the insufficiency of essence and chi will result in a weak body and declined vitality. Okay? The disease will be serious too. By means of vitality observation, we can know the patient's condition such as the state of essence and chi, the state of viscera, and the seriousness of disease. It plays an important role in diagnosis. Okay? To observe vitality, one should put attention to the patient's facial expression, mental state, physical activity, and reactivity. The special emphasis should be put on eye movement. The eye is regarded as the window of the liver and the messenger of the heart. Okay? All the essence and chi of 5 sang viscera and 6 full viscera flow up to the eyes. It was taught by the ancient that the vitality is stored in the heart and manifested in the eyes. Thus, the key of vitality observation should be the observation of the eyes. 4 conditions should be discussed in the vitality observation. They are full vitality, lack of vitality, loss of vitality, and false vitality. First, we discussed the full vitality. It is also called having vitality. It is the normal manifestation of sufficient essence and chi and exuberant vitality. Even if suffering from certain illness, it means the genuine chi has not been injured and the vitality has not been weakened. So the illness is not serious. Full vitality is manifested by the lustrous complexion, alert and lustrous eyes. Natural expression, clear speech, normal mentality, well-rhythmic breathing, plump muscles, free movement of limbs, and agile reaction. Among them, those reflecting the sufficiency of the heart chi are the lustrous complexion, natural expression, clear speech, normal mentality, and agile reaction. That reflecting the sufficiency of lung chi is the well-rhythmic breath. Those reflecting the sufficiency of spleen chi are the plump muscles and free movement of limbs. Those reflecting the sufficiency of liver and kidney chi are the alert and lustrous eyes. The sufficiency of the 5 sang visceral essence and chi means health or the favorable prognosis through suffering from the illness. Second is the lack of vitality. It is a condition of no enough vitality. This condition is the most common one in clinic cases. It is manifested by less lustrous complexion, less lustrous eyes, listlessness, shortness of breath, indolence of speaking, retarded reaction, fatigue, and sleepiness. Lack of vitality is due to the insufficiency of essence and chi of the 5 sang viscera and is commonly seen in deficient syndromes. Third is the loss of vitality. Loss of vitality is the reflection of essence insufficiency, declined vitality, and serious damage of the genuine chi. It marks the failure of the visceral functions and means critical condition and unfavorable prognosis. The loss of vitality is manifested by the dim complexion, dull and gloomy eyes, indifferent expression, sad mentality, sluggish reaction, feeble or intermittent breathing. Less muscles, difficulty in acting, even coma with murmuring, floccillation, or sudden fall with unconsciousness, closed eyes with open mouth, paralyzed hands, urinary and fecal incontinence. Among them, that reflecting the failure of the heart essence and chi is the dim complexion, indifferent expression, sad mentality, and sluggish reaction. That reflecting the failure of lung essence and chi is the feeble or intermittent breath. Those reflecting the failure of spleen and stomach essence and chi are lean muscle and difficulty in acting. Those reflecting the failure of liver and kidney essence and chi are the dull and gloomy eyes. As the coma with murmuring, floccillation, open mouth with paralyzed hands, urinary and fecal incontinence, they reflect the crisis due to the evil sinking into the pericardium or prostration of the essence and chi. Number 4 is false vitality. This means a kind of pseudo phenomenon of temporary improvement which appears suddenly at the crisis crisis stage when the patient's essence and qi are extremely declined because of chronic disease or serious disease. For instance, the former indolence of speaking, weak and intermittent voice suddenly turn into polylogia, liking to speak and clear voice. The former listlessness and unconsciousness suddenly turn into consciousness and spiritedness. The former dim complexion suddenly turn into flushed, zygomatic region like being made up. The former poor appetite or anorexia suddenly turns into excessive appetite and so on. The false vitality marks the essence and qi will be exhausted and the yin and yang will be divorced because of the failure of yin in a stringing yang, which result in the outward scape of deficient yang. This means the exacerbation of disease condition which is dangerous critically. So mas malala po na condition. It was called by the ancient as the last regions of the setting sun or the last night of a dying out candle to analogize the pseudo phenomenon of the temporary improvement of a period during critical stage. So more worst condition po pag ganito po yung nakikita sa patient, which is false vitality. False vitality is the state which just before the death. The differences between full vitality and false vitality are: first, the false vitality usually appears after loss of vitality in fatal cases and is obviously not in accordance with the whole development process of disease condition. Second, false vitality is only a temporary phenomenon which will become worse promptly in short time. During the process of disease, that the condition changes from full vitality to lack of vitality, or from lack of vitality to loss of vitality, even to false vitality, is the mark that the visceral essence in qi become gradually deficient and the disease condition becomes serious from mild. In the contrary, that if it is from loss of vitality to lack of vitality, even to full vitality, marks the visceral essence and qi is restored gradually and the disease state is lessened. So observing the changes of vitality in the clinic has an important significance for understanding the transformation of diseases. So ito po yung i-observe natin, yung changes ng vitality, either it is getting worse or improving. Okay. Fifth is the mental abnormality, which includes the fidget, delirium, and the mental disorders such as depressive psychosis, manic psychosis, epilepsy, and so on. So sa table 1, for the differentiating full vitality, loss of vitality, and false vitality. Sa complexion, yung full vitality is lost truth. Sa loss of vitality, it is dim. While sa false vitality, flash zygomatic region like makeup suddenly. While sa eyes, yung full vitality, it is alert and lost truth. Sa loss of vitality, dull and groomy. While sa false vitality, there is sudden lost truth. Sa breathing naman, sa full vitality, it is well rhythmic. Sa loss of vitality, feeble or intermittent. While sa false vitality, there is none. Sa figure naman, sa full vitality, it is plump muscles. Sa loss of vitality, lean muscles. While sa false vitality, lean muscles also. Okay? Sa senses, sa full vitality, there is consciousness and agile reaction. Sa loss of vitality, segmentality, dull reaction, even comma with murmuring, sudden fall, close eyes with open mouth. Sa false vitality, sudden improvement, clear voice. Sa diet, full vitality, it's normal. Loss of vitality, there's poor appetite and anorexia. Sa false vitality, sudden excessive appetite. Sa urine and feces, sa full vitality, it is normal. Sa loss of vitality, there is incontinence. And sa false vitality, there is none. Okay? Fidget naman is general due to heart fire. After suffering from cold attack disease, there will be deficiency fixation accompanying with slight fever, insomnia with restlessness, which is caused by the remained heat and insufficient in fluid. The severe one of deficiency fixation is called indescribable fixation. Example, the smothering feeling in the chest with no way out. The severest one of deficiency fixation is the smothering fainting. Fainting all day with restlessness, even to coma with delirium, which is often due to the heat evil attacking on the heart and kidney. Sa depressive psychosis, the manifestation of depressive psychosis are apathy with hypologia, murmuring, soliloquy, laughing or crying irregularly, and in low spirit of common condition. It is often due to the stagnated phlegm and chi covering the mind. Sa manic psychosis, the manifestation of manic psychosis are raving with square word, madness and restlessness, singing at high place, wandering nakedly, hitting people, or destroying things regardless of relatives or strangers. The common cause is the stagnation of liberty, transforming into fire and phlegm, and the phlegm fire disturbs the mind. Sometimes it may be caused by exorbitant heat or accumulated blood in Yang-Min region. Next, epilepsy. The manifestation of epilepsy are sudden syncope with saliva drooping and tick of limbs. After onset of the patient looks like no abnormality. It is often caused by the liver wind with phlegm and the phlegm fire disturbing the heart. Thank you for your attention.